So this is our hip flexor flexibility stream. Rep targets here aren't so important. We're looking more at this first test, which is Thomas test 1, 2 and 3, and that's going to help to inform which exercises we should work on. But in terms of time, once you get into the exercises, we suggest doing about 60 seconds or 6 lots of 10 seconds where you move into the stretch. Developing flexibility through the hip flex is important for tasks like walking, running, lunging, and a lot of people associate it with good posture. Often people will complain or have difficulty with back pain if they have tight hip flexors as well. So the Thomas test, the first one with the straight leg, we're looking at the iliacus and the psoas. The test here, we want to have the leg 5 to 10 degrees below parallel, which the line will show. The bent leg version, we're looking more at rectus femoris. So you want to have the knee below parallel and the shin angle wants to be inside of 90 degrees, which basically means that that ankle should be, getting as close towards the table or the bench as possible. And then finally, the front angle, which is Thomas test 3. This is looking more at the TFL. We're looking here that from this front angle, we're seeing a straight line between the hip, the knee, and also the foot. Okay, and that's showing that we've got enough range of motion there through the TFL. So once we actually get into the hip flexor exercises, if you're struggling with the straight leg test and you're not able to get that below parallel, 5 to 10 degrees below parallel, then lunge and the deep lunge are going to be good options for you. So across the board for all the hip flexor exercises, it's important that you have a good posterior tilt. So you're tilting that pelvis under, which my hand in this video will kind of show you what that means, but essentially you're kind of basically flattening your back. Okay, secondly, you want to be performing deep belly breaths, and finally, you want to really be feeling your hip flexor muscles lengthen as you perform any of these exercises. So it's really common for people just to kind of dump the weight forwards when they do any sort of hip flexor stretching, and they end up kind of just stretching the ligaments of the hip, which can actually cause more instability around there. So it's important that you're able to hit this position and then really get that nice deep stretch through the muscles. From there, if you're struggling with the bent leg variation, so if you're finding that you're not able to get the knee below parallel with this one, so the second Thomas test that is, or you're finding that the shin angle is greater than 90, so the knee angle is greater than 90, so your foot's quite far away from the bench that you're on or the table that you're on, then working on your couch stretch is going to be a really effective way of developing that. So obviously putting the foot up against the wall or against a bench or anything like that where it's fixed, and then you can obviously move your knee further back and move your body further back to increase the stretch there, and obviously drive that hip forwards, create that posterior pelvic tilt to get into them hip flexors a bit more. And then finally, if you're finding that the front angle, so you find your foot actually travels inside the knee and the hip as you perform that Thomas test 3 and you look at yourself from the front, then you need to make sure when you're doing any of the hip flexor exercises that you're pushing your big toe down. So you've got your ankle dorsiflex and you're pushing your big toe down into the floor, and that toe is directly behind your knee in a nice straight line. Okay, and that will help you to develop that flexibility through the TFL and help you to stop the rotation happening where your foot kind of travels inside of that hip and knee. So awesome, guys. Use the Thomas test to inform which exercise to perform, and then again, as we said at the start, perform about 6 to 10 sets of 10 seconds, or you can perform that all in one go, like a 60-second hold all in one. But essentially this will help you to determine what aspects of your hip flexors need work, and then obviously you can work on them with the exercises shown.